Hi, everybody. It's Professor Wells. Today, we're going to go over Chapter 12, which is where we're going to dive a little bit more into dental implants, the types of implants you might see, and how to care for them. So did you guys know that dental implants were first attempted about 4,000 years ago? The ancient Chinese tried to place bamboo pegs in the jawbone in an attempt to recreate a tooth. Then 1,000 years later, the Egyptians made another attempt by nailing a copper stud into the jawbone. No thanks, that had to hurt. Even the Mayans tried to implant carved shells. Then years later, in 1905, C.R. Scholl introduced a porcelain root form implant into the modern world. It wasn't until 1969 when it was discovered that integration of bone could be successful on the surface of a medical implant. And then the Brainmark dental implant system was introduced into the States in 1982. We've had so many advancements in implant therapy since then and continue to do so as we speak. There are three main types of dental implants: subperiosteal, transosteal, and endosseous. So the subperiosteal, this is where a surgical excision exposes the bony ridge and an impression is made. Then a metal framework is fabricated and placed over the bony ridge with metal struts protruding through the soft tissue to support the prosthesis. The transosteal is placed from under the chin and has a flat plate where 2 to 4 threaded posts projected through the anterior mandible into the oral cavity, and these posts support a denture. That sounds pretty painful if you ask me. Then the endosseous implant. This is the most popular implant that is used today. It has the highest success rate, and these are placed into the bone and act like a root substitute for missing teeth that supports a crown or a prosthesis. We'll be focusing mostly on this type of implant throughout the chapter. What do we use implants for? Implants are used to replace a missing tooth, a missing teeth, or even a full arch when extreme ridge resorption has occurred. Clinical studies have shown long-term success rates of greater than 10 years with approximately 90% in the maxilla and 95% in the mandible. Success rates are related to the quality and density of the bone where the implant is being placed. Generally, the bone in the mandible is much more dense. Even though implants are the ideal option for treatment, there are some cases where we would not want to use them. Patients who have had advanced cardiovascular or respiratory disease are not good candidates for surgery. Diabetes affects the patient's ability to fight infection and heal properly. And patients with bone density issues like osteoporosis that have taken bisphosphonates risk delayed healing of the bone and osteonecrosis. Smokers and the immunocompromised patients are also not good candidates. However, implant therapy is a case-by-case procedure, and just because the patient is not a good candidate for implants does not necessarily mean they cannot get them. There's several benefits to implants, and patients are becoming more and more accepting of this treatment option. They're easier to clean, they help preserve bone, and they do not go in and out of the mouth, which most patients find desirable. Complete dentures cause the muscles of mastication to weaken and resorption of the bony ridge that is required to hold them in place. Implant-supported dentures are more comfortable for the patient, and they're able to chew harder foods and have limited shifting or pressure on the soft tissues of the mouth. There's 3 basic components to dental implant crowns and bridges. The implant fixture, which is the portion of the implant that is placed in the bone and remains there to support the crown. The implant abutment, which is the attachment of the implant fixture that protrudes through the gingiva and acts like a tooth preparation on which the crown attaches or the prosthesis rests. This is usually attached to the fixture with a screw. The healing abutment, this is attached to the fixture and is placed temporarily to allow the gingiva to heal around it and form a gingival cuff and sulcus. This is commonly known as the healing cap. Then the implant crown or the actual prosthesis. This is the actual replacement tooth or bridge that is replacing the missing tooth or teeth. The most common type of implant used is made out of titanium. These are lightweight, corrosion resistant, and more biocompatible with the oral tissues and they have a less chance of failure. Their elastic modulus allows for any force placed on the implant to be distributed evenly between the implant and the bone. Bone will grow around and adapt to the titanium through a process called osseointegration, and this will keep the implant stable. When it comes to implant placement, the best way to figure out the ideal position is by using a CBCT image or cone beam. Cone beam, remember you guys, is a 3D image. X-rays that we look at are only 2-dimensional. So this is a 3-dimensional image that can help show bone density in different areas. And this also helps to provide the proper angulation for the implant being placed. Combined with a scan of the arch where the implant is going to be placed, a surgical guide can be fabricated. This allows the doctor to put the implant exactly where it is supposed to go with minimal errors, giving the implant a longer survival rate. Before surgery, it's important that we obtain informed consent. Discuss with the patient the risks of the procedure and review the post-op care and what to expect in the next few weeks. The usual risks include excessive bleeding and swelling, perforation of the maxillary sinus, puncture of a major blood vessel, and possible nerve damage. There's also a risk that the implant may not integrate with the bone, and in that case, the implant can fail. Post-op instructions are similar to an extraction, so no smoking or drinking through a straw, ice packs, brush area lightly, resume prescribed medication, etc., etc. Each office has their own protocol on what they want their patient to follow, so it'd be best to ask about it so you know what to tell your patient. There are 3 different types of implant surgeries available. There's a 1-stage, a 2-stage, and an immediate placement. So stage 2, or the 2-stage, there's 2 phases. So first, the bone is exposed, then a hole is drilled into the bone at a low speed with a sterile saline irrigation to prevent overheating. This is important because overheating the bone can cause damage and failure of the implant and bone to integrate. A series of burrs starting off small and increasing in size to the size of the implant being placed are then used. Once the right size is reached, the implant is often screwed into place. A cover screw is then placed into the exposed area of the implant to prevent tissue from growing into the hole where the future abutment will be placed. The second phase usually occurs about 3 months later. The cover screw is removed and the healing abutment is placed. The tissue is then repositioned around the healing abutment, and after a few weeks, impressions can be taken for the final crown. With the stage 1 surgery, this option is good for a case that's not very complicated. This is performed much like the 2-stage, the only difference being that a cover screw is not placed. Instead, the healing abutment is placed. This option saves the patient from having a second surgery. Then there's also the immediate placement. When implant placement involves the extraction of a tooth, sometimes an implant can be placed directly into the socket along with the bone graft. This has a slightly higher failure rate when compared to the stage 2 and stage 1 process. The whole implant process can take anywhere from 3 to 6 months to a year from start to finish. We won't go into the restorative phase or impressions needed, but I want to talk to you a little bit about the different kind of retention the implant crowns have. So there is a screw retained implant, and this allows for the implant crown to be easily removed if necessary. If the crown ever becomes fractured or loose, the screw can be loosened to take it off and possibly have a new one made. So the screw must be tightened properly to prevent it from coming loose, but not too tight as to where it can cause the material to break. There's an access hole on the top of the occlusal that is filled with resin material once the implant is screwed into place. Cement retained implant crowns do not come off easily, and if we were to break them, hold on here, sorry. If the cement is not cleaned off properly, the remnants left behind could cause peri-implantitis and loss of the implant. Implants can be used to support partial or full dentures as well. Examples of this would be the all-on-4 or a snap-in denture. Bone grafting. So to have a successful implant, adequate bone must be present in order to withstand the forces placed on it. Bone grafting is done to increase the width and the height of the bone at the implant site. One type of grafting is done before implant placement, and the other type is done at implant placement. The types of bone grafting are, there's 4 general categories. So there's autografts, which are harvested from the patient's own body, allografts, which come from a donor, so like cadaver bone, xenografts, which come from cows or pigs, usually it's bovine bone, and then alloplast, which is a synthetic material. Another kind of surgery that may be necessary when we're placing an implant on the maxilla. Sometimes when patients lose teeth, the maxillary sinus drops into the area where we would normally place the implant, and a sinus lift may be necessary. I literally just had this conversation with a patient yesterday, a 32-year-old female who is now ready to replace her teeth. However, her sinuses have dropped so low that there is probably about 2 millimeters of bone between the alveolar ridge and her sinus wall. So this is something that may need to be performed. This is usually done by an oral surgeon or periodontist. This procedure, what they do, they expose and cut the bone to create a window to the floor of the maxillary sinus. Once they achieve that, an instrument is used to separate the sinus membrane from the bone and lift it up. Grafting material is placed into that space, and the soft tissue flap is repositioned and sutured. Healing time is usually about 4 to 6 months, and that's before they can actually place the implant. Sutures. Sutures are better known as stitches. They're used for many procedures that we've discussed, extractions, implants, sometimes even biopsies. Many times the assistant or the hygienist may be asked to assist in the placement or removal of them. Usually it's the removal on the hygiene side anyways. Their main purpose is to hold the tissue together to allow proper healing. This usually takes about 7 to 10 days. The most widely kind used are the absorbable sutures. This just means that the suture itself is actually broken down by the body's proteolytic enzymes, and this eliminates the need for a second appointment to where they need to be removed. With the non-absorbable sutures, they need to come back and the dentist or assistant or even the hygiene has to remove it. We don't really need to go into the needles because depending on the state, which in the state of Indiana, hygiene and assistants are not allowed to actually do the suture themselves. So you guys can look over this in your book if you feel, but you won't be tested on it. So don't get too caught up in all of that. Early failure of implants is usually due to failure of the bone to integrate with the implant. This can be caused by poor surgical technique, lack of proper infection control, but usually it's the excessive generation of heat, infection, poor bone quality, or placement of loading forces too soon on the implant. Failure after a period of time is usually caused by bacterial infection extending from the peri-implant tissues into the bone or overloading of the implant during function, leading to loss of supporting bone. To have a long-term success, the bone must be fully integrated. Excessive force aligned with the implant. Excessive force should be aligned with the implant, and the implant needs to be kept clean. When this is achieved, the implant crown can last up to 20 years, if not longer. Implant maintenance is really key. The implant surface can accumulate plaque and calculus just like our natural teeth. Tissues surrounding the implant, the peri-implant tissues, will become inflamed, and if this isn't controlled, the inflammation and bacterial invasion can progress into the bone and this is where we get peri-implantitis. Hygienists must implement an effective soft tissue management program in order to maintain and reinforce home care techniques. Implant patients can utilize many home care aids to incorporate into their regimen, like the N-Tuft brush or interproximal brush, flossers, superfloss, wooden plaque removers, and even antibacterial rinses like chlorhexidine. A lot of patients like to use Listerine, whatever they prefer. As far as their hygiene visit, a periodic radiograph image may be requested to check the bone levels around the implant. A visual assessment will be needed to check for peri-implantitis, swelling, exudate. You may even want to check for mobility. Probing should be done with a very light touch and a plastic probe so that the biological seal is not disturbed and the implant is not scratched. Special instruments are used to clean the implant. They're made from titanium because titanium will not scratch the titanium implant components. When it comes to polishing, this is only to be done if deemed necessary. You don't want to use the fine, medium, and coarse paste because it can cause those tiny surface scratches. And when that happens, it allows for plaque and bacteria to cling to the area. Tin oxide or non-abrasive polishing paste can be used with a ProfiCut using very light pressure. And I know we've talked about this already, but air polishing is an excellent way to clean implants. Some offices don't have air polishers, so this is where we would use selective polishing. When you go to polish the teeth, just skip the implant. You can wipe it off with the gauze square if you need to, but the whole goal is to not create those scratches on the implant and cause a problem. In summary, dental implants are becoming more accepted by patients as a long-term replacement option. Having a success rate of approximately 95%, implants are an ideal means of treatment. It's not enough to just have an implant placed. They must be routinely maintained to ensure their success, and we as hygienists must know how to properly care for them. If you guys happen to have any questions or comments, please email me at hwells14@ivtech.edu.